Hi everyone, welcome back to my channel. Thank you so much for being here. If you're coming for the first time, thank you so much and please feel welcome. My name is Nancy. I talk about nursing, lifestyle, travel and other things in life, so feel welcome. I did a recent video where I shared with you guys about how I got my job in ICU, and in the video I mentioned that I will be compiling some questions that you may be asked during your interview if you're looking to get a job in ICU. So if you want to know what those questions are, please stick around and we'll be talking about them.
Get in my way now, don't be shy. We'll be here dancing day and night. Get in my groove now, don't be shy.
A lot of us get nervous when we think about going for interviews because it can be an intimidating process. During your interview, you may get asked some clinical questions because in ICU a lot of things happen and they will expect you to at least have an idea of what to do to help the patient. So from what I've learned, I think all they want to know is that you are going to prioritize the patient's safety and you will know when to call for help. So if you get questions like if you found a patient not breathing, or someone collapsed, or a patient started desaturating, what are you going to do about it? And I think in such situations, like I said, put the patient's safety first. If they're desaturating, put some oxygen, try to suction, those basic things. You don't really have to go overboard in trying to diagnose the patient. It's you doing like first aid for the patient and then calling for help if you think it's a serious situation. If someone collapsed, of course, you're just going to check them, pull the buzzer or call for help and start CPR if that's the right thing to do. So in this video, I will not be going into details about clinical questions, but if you are due for an interview in ICU, I would suggest that you go to Google or YouTube because I saw so many resources talking about questions for ICU or even nursing interview questions in clinical questions that you may be asked during the interview. So let's get straight into the questions that I have compiled. The first question that you may be asked is, why do you want to leave your current job? So in my opinion, I think you should just be honest and talk about your passion, why you want to move to the new job and the reasons that you are leaving your old job. There may be reasons like maybe you don't get job satisfaction or you want to explore more. Just give genuine reasons and be open about your passions and the changes that you want to make in your career. So another question that you may get is, what about critical care attracted you to want to work as an ICU nurse? So in this situation, you can give an example of why you really want to be in ICU. It could be like you had a placement there and you really loved it, you love the environment, it's challenging and you would want to learn new things and you feel that that is the best place for you to do that. And again, remember to share your passion and tell them of the skills that you have that will be beneficial to the unit as well. So number 3, you can be asked a question like, how are you going to involve the patient's family in the patient's care? Now, if you're working in ICU, this is really important because a lot of the patients are sedated and they are not aware of what is happening to them. You need to involve the family in the care of the patient because the next of kin in this situation will be the one who will be making decisions regarding the care of the patient that you're having. So it's really important that you know how to talk to the family, how to explain to them what is happening. And remember that this family is also traumatized. They're going through a lot because the moment people hear that their loved one has gone to ICU, they just start thinking of the worst. So you will be talking to them, trying to reassure them and just supporting them. Make sure to include this while you're answering the question about involving the family because you will be taking care of the patient and also the family. And remember to mention that you will be confirming who the next of kin is, just so you're not giving out information about the patient to just anyone who says that they know the patient. Another question that they may ask you is, in the past, have you had a patient who is experiencing difficulty in communication? And if you did, how did you deal with that? So the reason they may ask you about this is because in ICU, a lot of the patient will have trouble communicating. For instance, someone may be having a trachea tube and therefore they are not able to communicate if they haven't reached that stage of weaning them off the trachea. Some of them may be having the tube down their throat. They may not necessarily be asleep. They may actually have the tube and will be awake, but they cannot communicate with you because they are not able to talk. So they will want to know how you will help this patient to communicate their needs. And some of the examples that you can give is that you could use visual aids. You could use like those charts where they will be able to point the letters for you to make out a word. You can help them, putting on their glasses if they're not able to see properly. You can use iPads or phones where they will be able to type if they have enough movement on their hands. And also, if there is a problem with language, you can always mention about getting a translator. So another question that they may ask is, have you had a difficult patient? Maybe a patient who is really agitated, they don't want to hear anything you're telling them. Maybe they're just angry and they're refusing care. How did you handle that? We do experience patients who are agitated, and in ICU especially, because people may get delirium after being through all that medication, after being a patient in ICU, maybe they had tubes down their throat and they're still coming into terms with that. So some of them may be agitated, and the person interviewing you will want to know if you just have an idea of how you would handle such a patient. And I think you would just need to tell them that the first thing is to try and listen to this patient, because some of them just want us to listen to them, show them that you're listening to them, and address the worries that they are talking about. And sometimes they might just, calm down. Sometimes hostility comes from a point of being scared and not knowing what the outcome is going to be. So just be patient, talk to them, listen to them. I think if you mention that, that is going to be a good answer. Another question that I think you can get is, how do you handle stress as a nurse? Okay, and after all this pandemic thing, I have seen a lot of nurses quit or change jobs just because we went through a lot. And now a lot of the hospitals, especially in the UK, are all about self-care. Well-being is a big thing now. So I think they will want to know how you as a person try to release your stress. And this is an easy one because I think all of us have our own coping mechanisms. It could be, for example, like for me, it's the gym. You could be hanging out with your friends. It could be travel. It could be sleeping, therapy. It could be just being with your family. Just share and be open, because I don't think there's any wrong coping mechanism. They just want to know that you have some. It's important for everyone to have a way of coping with that kind of stress. So during your interview, it may get to a point where the person interviewing you may tell you or ask you, do you have any questions for us? And this is a question that used to make me nervous because I didn't know what to ask them. I didn't want to look bad. I just wanted to give the best image of myself. So a lot of the times, if someone asked me during an interview, I would be like, no, I think it's okay, no worries. But after being here for a while, I have learned that these people are going to be interviewing you, but it's also good for you to check if they are fit for you, if that's the best place for you to go. So things you would ask are, number one, money. I always ask because from the job advertisements that I've seen, they don't actually give you a clear pay. They always say their pay will be like, 30,000 per year, but you don't have an idea of how much you'll be getting per hour. You don't know how much you'll be getting per month. So I will want to know, because if that's not enough for me and I take the job, then I will be the one who ends up suffering. So you can ask them, do you have an idea of how much I will be getting per month or per hour? Because from your advert, it says this, or it gives a range of between 30 to 34. I just want to know so I can be prepared. It's not wrong to ask, just ask it in a nice way. The second thing that you can ask them is, what growth opportunities are there in your unit? I would just want to know what you guys are offering me, or what opportunities are available in your unit if I join you. And the third question that you can ask is, what strategy does your unit have, or what strategies have you put in place to ensure a healthy working environment for staff? I think those are good questions for you to ask the employer because, like I said, they are interviewing you and you're also interviewing them to see if they are fit for you. Because if they are not, there are so many other job offers out there that you can always go to. I hope it's given you some idea of the questions that you can get and how you are going to answer them. I may do another video talking about clinical questions that you may be asked for ICU in future, and I will also try to include the drug calculation test. So if you haven't subscribed, please subscribe for content like this. And yeah, thank you for watching this far, guys. I will see you in my next video.
Cause I got this list of my favorite things. You could be the part where it all begins. You could be the first and the second and the third and the rest of it.